first of all, I'm very thankful to all of you for spending time and traveling this place. And before embarking, and I'm also thankful to Mr. Gate for organizing this event. I hope you will stay comfortable. Before embarking on my presentation, I would like that it should not be a formal lecture, but it should be informal talk so that we can learn from each other's experiences. Most of you are very experienced persons, and we represent the part of the world which is almost the low resource countries. So therefore, we share a lot of cultural and other things. So I'll be talking about I think you have done. So we'll be talking about how the journey to establish national disease registry in low resource country. This is really important. And this is my introduction. I'm the vice chair of the HealthRAB, as well as I'm the distinguished national professor of HEC and working at Janassan Medical University. And I'm also adjunct professor at Bell College, Texas. So the National Disease Registry, what it is, it's basically an organized system that uses observational methods so that data can be collected in the form which is palatable as well as useful for research. So therefore, the research information regarding the people, what sort of clinical presentation they share, what is the outcome, what is the prevalence, so therefore, and how to, so that we can establish the curriculum accordingly. So these basically collect information that can be used for next teaching training as well as research. So what are the challenges? If somebody is working in developed countries, there is no problem regarding resources. Working in developing countries like Pakistan or Afghanistan, so there is a problem because the cost, first of all, funding, where should the funding go? And then selection of the institution and primary investigator and their training, because there should be uniformity among them. And then data accuracy, because the data entry people they don't understand that if they do something error or wrong, it will have enormous impact on that. And diverse population in Pakistan, we have multi-language people, like if you develop in English they don't understand, Urdu they don't understand, so in peripheral area, culture sometimes in our country, and I know in your country, like in Afghanistan, in some part they speak Pashto, but in other part they don't understand Pashto. So therefore, we have a lot of low literacy rate. They don't understand. Sometimes they ask, why you are asking about my daughter's name and this and that? Because culturally they want to consider that it's not related to treatment. And then data sharing and the confidentiality is a real problem, because if we collect something, this is a responsibility on us that we should take care of its confidentiality. People talk like because they don't understand the ethical aspect. So current national disease registry in Pakistan under the umbrella of the HealthRAB, I want to first you can see Pakistan National Joint Registry. That's very important, and this is very mature registry. And then you can see diabetes registry, who is Professor Basit is the pioneer of that, and we have seen a lot of people Pakistan is number one on the diabetes prevalence. We want to know why this happened, how the people present, what is the treatment gap, and what will be the complication, because food, many complications occurs, and as well as sexual aspect. All we have to consider this. And therefore, you can see the cardiac registry, then stroke registry, pediatric registry, spine registry, hip registry, gynecological registry, and half of the population in Pakistan is comprising of females. And then my field, I am psychiatrist, the psychiatric registry of Pakistan. So these are the registry, and this was developed with the collaboration of the Pakistan. This is very important. If you are not taking the stakeholder like the orthopedic surgeon, you will not go ahead. Similarly, if you don't take some opinion from the psychiatrist, they will not take it seriously. So therefore, this was the first, and you can see that Professor Shahid Noor, who is a very stalwart of Pakistan orthopedic field, he has developed a lot of system, and you can see the year initiation in 2014 he started this, and then with period of time he developed to such a large level, and people are now registering, and they have the hip registry, you can see the knee test registry, and this was the 10-year anniversary report celebration they have done. This is basically the founder of this HealthRAB, Professor HealthRAB, who is a renowned person, pediatrician. And these are the annual reports by the Joint Registry. You can see this, well known that they actually, at what level they are now quoted with references. Then you come to the cardiac registry, where you can see that the cardiac surgeons are on the same platform, and then you can see the Bashir Naik, who is very authority on the subject, and people respect him a lot, including we all respect him. He has done a lot of good things for Pakistan. And these are the annual reports he published regarding that. Then you can see we have Professor Basit, who really respected a lot in the field as well as at national level, and he has he's also now he's the chairman of HealthRAB. We have to correct this. Now he's chairman, and this is the year of initiation, Diabetes Register of Pakistan 2018. And number of registered patients, look at this. And people are really taking full interest to be inducted in this. And this is the Diabetes Register of Pakistan annual report has been published. And this then become the pediatric orthopedic registry, which is the Professor Anisul Bhatti is the appointment of this. And Anisul Bhatti has done a lot of initiative from 2021. Then 3 reports has been published, especially about the infants. And this is the hip registry, and then the hip registry is directed by Professor Muhammad Amin Junai. Then in 2023 we started from Sakhar, the Psychiatric Registry of Pakistan. There were no concepts. We were thinking how to start. Should we start all the diseases? Then we picked one disease, that is schizophrenia, which is, and this started. William is here, and we have started. We have initially included 3 centers from Pakistan, but it will be then approached the other sector as well. The new diseases are in the pipeline are hypertension registry, urology department, gastroenterology, ophthalmology, and then gynecology. And now these few slides are very important. What are the steps to establish these registries? The first step is the selection of registry director, so that he can have some concept. Then selection of the disease, which disease is of very important, and that is needs some attention and registration. And then selection of the registry committee, then is developing case report, a form, approval from the IRB. That is very important. Until we have the ethical aspect, we cannot go ahead. And then coming to development of software. Software is and then training of the institution and the private researchers, so that there should be uniformity in the data collection. Data collection of research, and then continuous monitoring, and then publication is one of the part, because that knowledge should be spread to other people so that they take full advantage of that. Now, how HealthRAB supports these various societies like Orthopedic Society, Psychiatric Society, or Cardiac Society? Registry web design, development online registry software, then organizing meeting with the registry steering committee, then publication of the annual report, organizing best delivery. These are the various steps. And with this, I'll end my talk. Thank you very much for your attention. If you have any question or query, yeah.
Yes, thank you for a wonderful presentation. And my question is about this diabetes registry. Is it
NIC, national identity card will be taken as a national MR number for every individual. So by tomorrow, we hope that all these registries will get a boost when the national MR is announced. Up till now, these registries are run by individual champions of societies themselves. They have developed their own software or ID. Now for diabetes, people enter by web portal. So each doctor who wants to say that I would like to be part of the registry, he gets a login and this, and then he enters his patient. It's not patient entering the data. It's the doctor, physician, center, institute, clinic, whichever would like to have it. They have a login number and they start putting in the data. So 100 plus centers putting in the data for diabetes.
In a lot of newspaper, professors have appreciated this decision of the government that the national identity card should be used for any type of document related to health.
So what is the interest of patients to be entered in this register?
There is no interest to patient to start. It's not for patient. It's for basically for doctors, for policymakers, for healthcare workers. It's not a patient side. Patient side is easy. You can develop any application, check products, hundreds of things for the patient. This registry or these registries are first meant to get the data for national health services, for policymakers, for hospitals, for clinics to decide are they meeting up to the mark or not. So these registries, remember, all across the world are not patient-centric. They are health system-centric. For patients, we have applications, chatbots, advisory services, helplines, etc.
But one thing, this will improve the quality of assessment because in our country, when patients are not given sufficient time, when they are given this much time to ask anything, they are very much satisfied, and we can have a quality of care, assessment, and treatment as well.
The reason why I'm asking, we are facing big problems. We are doing the health register right now in Uzbekistan, but our previous register was just like observational cut of register, like a cut in a time, let's say, once
Once in a time, that's right.
register.
Yeah.
Now we
Ongoing.
launching online leave register, and this is kind of problem, technical problem.
Yes.
And we can still have only about 60% of patients registered in dispensaries entered to this register. So we just have a lot of things to
But
manage.
60% is a big number.
Yes, I compare your numbers. Yes.
It's a big number. 60% if you have got patients coming in and getting registered, this is a big number at the start. So not to worry. But then from HealthRAB point of view, we can help you out in developing a national level software, etc.
And update of this data for each patient is performed. When is updated these patients that are?
Each time the patient reports to that center, if he is in the registry, his data is entered into the same registry.
Ah,
It's not that you need a separate data entry operator to enter the data. It's the clinics have the software. So a patient walks in and he's already registered to diabetes, for example. Each time he visits, his data is entered into the registry.
Follow-up notes are there.
And can you share the form which data are collected?
Yes, we can share with you. Yes. And you're inviting us to Uzbekistan anyway, so
We will
we'll
see.
take care of it.